I want you to think about every conversation you've ever had about breastfeeding. Every piece of advice, every pamphlet in the maternity ward, every well-meaning relative leaning over your hospital bed. What did they talk about? The baby, always the baby. How breastfeeding gives baby the best nutrition. How it boosts baby's immune system, how it protects baby from infections, how it is the best thing you can do for the baby. And all of that is completely true. But here is what nobody told you. Breastfeeding does not just feed your baby. It transforms you. Biologically, it transforms you. Chemically, it transforms you. Hormonally, and it transforms you cellularly. Now, from the very first feed, your body begins a process of change so profound, so layered, so deeply orchestrated by science that researchers are still uncovering new pieces of it today. And most mothers go through this entire transformation without knowing a single thing about what is happening inside them. Today, that changes. I'm going to take you inside a breastfeeding mother's body. I'm going to show you the hormones feeding through her system the moment her baby latches. The cancer risks she is quietly, unknowingly reducing with every feed. The changes happening to her heart, her bones, her brain, her metabolism that nobody at the antenatal clinic ever mentioned. Now, this is the breastfeeding conversation that is long overdue. And whether you are breastfeeding right now, thinking about it, have done it before, or you're simply curious about what the female body is truly capable of, this video is for you. Okay, a real quick one before we start. I checked my analytics and 98% of you are watching without subscribing. You know who you are, of course, and I would like to ask you to hit that subscribe button, tap the bell, and drop a comment telling me what health topic you want me to cover next. I read every single one of your comments. Are you done with that? Perfect. Now we can begin. And I want to say something to every mother watching this, whether you are breastfeeding, formula feeding, or somewhere in between. This video is not here to make you feel guilty. It is not here to pressure you. Breastfeeding is deeply personal, and every mother's journey is different. What this video is here to do is give the science, the real, full, remarkable science of what breastfeeding does to your body, because you deserve to know what your body is capable of, and you deserve to know and know it with wonder, not pressure. So let's begin. And the first part that I would like us to begin with is at the very beginning. I want us to begin at the very beginning. Now, your baby is born. They are placed on your chest, and they find their way instinctively, perfectly to the breast. Now, the moment that latch happens, your body responds immediately, not in minutes, not in seconds. Now, two hormones flood your system simultaneously at that particular moment, and these two hormones will become the chemical architects of your entire breastfeeding journey. The first is prolactin. Now, prolactin levels surge each time a baby nurses, stimulating the milk-producing cells in the breast. Now, this remarkable feedback system ensures supply meets demand, adjusting milk production based on the infant's needs. Now, think of prolactin as your body's personal milk factory manager. Every time your baby feeds, prolactin rises. It signals the milk-producing cells in your breast to make more milk. Now, the more your baby feeds, the more prolactin, the more milk. Supply meets demand in real time, and your body is listening to your baby and responding. But prolactin does not just make milk. It does something else, something most mothers never know about. Prolactin also contributes to maternal behaviors, often inducing calm, nurturing state. Some researchers suggest this hormone may help explain why breastfeeding mothers often report feeling more attuned to their baby's needs. Now, that deep, quiet calm that many mothers feel while nursing, the sense of being completely present, completely focused on this tiny human, that is prolactin, a biological gift, turning up the nurturing instinct at the exact moment it is needed most. The second hormone is oxytocin. Now, oxytocin, often called the love hormone, is released during breastfeeding and promotes bonding between mother and baby. It also helps the uterus return to its pre-pregnancy size by causing contractions. Now, oxytocin is responsible for what lactation consultants call the let-down reflex, the release of milk from the breast when a baby feeds, but its role goes far beyond milk delivery. Now, the release of oxytocin represents one of the most profound psychological benefits of breastfeeding. Oxytocin plays a pivotal role in fostering a deep emotional connection between the mother and her baby. Now, this hormone is instrumental in promoting love, trust, and attachment, and it forms the cornerstone of a secure and nurturing relationship. Now, when you look down at your baby, at the breast, and feel that overwhelming wave of love, that is not emotion, that is chemistry. That is oxytocin flooding your bloodstream, chemically bonding you to this person you just met. And here is something that amazes me every time I think about it. That same hormone, oxytocin, is simultaneously causing your uterus to contract and return to its pre-pregnancy size. The same chemical that builds the bond between you and your baby is also physically healing your body from the inside. Now, two jobs, one hormone, the female body is extraordinary. Now, speaking of which, let us talk about the uterus, because breastfeeding effect on uterine recovery is one of the most immediate, powerful, and underappreciated benefit for the mother. Now, during pregnancy, the uterus grows from roughly the size of a pear to the size of a large watermelon. Now, after delivery, it needs to shrink back. This process is called involution, and oxytocin, released with every feed, is the primary driver of this. Now, every time your baby latches, a wave of oxytocin causes the uterine muscles to contract. Mothers often feel these contractions called after pains, especially in the first few days. They can be quite uncomfortable, but they are doing something important. They are shrinking the uterus back to its original size, compressing the blood vessels at the site where the placenta attached, and this reduces postpartum bleeding. Now, mothers who breastfeed experience faster uterine involution than those who do not. Loss or less postpartum bleeding also, and faster physical recovery. Now, your baby, in the act of feeding, is helping your body heal itself, and that is not metaphor, that is physiology. Now, let us talk about something that is on almost every new mother's mind, even if she does not say it loud: the body after pregnancy. The body after pregnancy. Now, the American Institute for Cancer Research reports that lactation increases energy expenditure, that is burning about 500 extra calories a day. 500 calories every day just by breastfeeding. Now, to put that in perspective, a 45-minute run burns roughly 400 to 500 calories. Breastfeeding burns the equivalent of a daily run without leaving the sofa. Now, the mother's body uses its fat stores to produce milk. In doing so, it lowers her lifetime risk of cardiovascular disease, even if she came in with that risk before pregnancy. Now, the fat stores your body built during pregnancy, specifically designed as an energy reserve for lactation, are being drawn upon with every food or every feed. Now, your body is literally using pregnancy weight to nourish your baby. However, and this is very important, weight loss during breastfeeding is not universal, is not immediate or guaranteed. Some mothers lose weight effortlessly while breastfeeding, others do not, because hunger increases to compensate for the extra calories burned, and the body is smart enough to protect some reserves. Stress, sleep deprivation, and hormone shift also affect how and when weight changes happen. Now, the point is not that breastfeeding is a weight loss strategy. The point is that your body is performing a metabolic miracle, which is burning hundreds of extra calories to produce a perfect, living, changing food source for another human being. That is remarkable, regardless of what the scale says. Now, here is the part of the breastfeeding hormone conversation that most pamphlets leave out. And I want you to pay attention, because while oxytocin and prolactin are doing beautiful things, there are other hormonal shifts happening simultaneously that can feel much less beautiful. Now, during breastfeeding, estrogen and progesterone levels, they remain low compared to pregnancy. And this hormonal shift can lead to vaginal dryness and changes in libido. Now, some women also experience temporary hair thinning due to these hormonal fluctuations. Now, let me say that more plainly in a language you can relate with. Breastfeeding keeps estrogen low. Breastfeeding keeps estrogen low. And low estrogen means vaginal dryness, which many breastfeeding mothers experience, discomfort or pain during intimacy. Now, this is completely physiological. It is not permanent. It is your body prioritizing milk production over productive or reproductive readiness. But it is real, and it is barely ever discussed. Also, there will be changes in libido, because prolactin, the milk production hormone, also suppresses sexual desire in many women. Again, this is biological and temporary. But if a new mother is wondering why her desire has changed, this is the hormonal reason. Also, temporary hair loss can be experienced, and the hair thinning that many mothers experience postpartum is partly driven by the drop in estrogen. Now, during pregnancy, high estrogen keeps hairs in a growth phase. After delivery and during breastfeeding, that estrogen drops and hair transition to a shedding phase simultaneously. Now, the result is the alarming clumps of hair in the shower drain around 3 to 6 months postpartum. It is not permanent. It resolves as hormones stabilize. But knowing it and knowing that is coming and knowing why can make the experience far less frightening. We have natural contraception, but with important caveats to it that come as a result of breastfeeding. Now, the prolactin surge delays the return of fertility for many women, providing natural birth spacing when breastfeeding is exclusive. Now, this natural contraceptive effect is called the lactational amenorrhea method, or LAM. Now, when a mother is exclusively breastfeeding, meaning no formula, no solids, nothing but breast milk on demand, day and night, her prolactin levels stay high enough to suppress ovulation in most cases. But, and this is absolutely critical, LAM is only reliable under very specific conditions. Exclusive breastfeeding, on demand, day and night, and only for the first 6 months. The moment any supplementary feeding begins, the reliability drops significantly. As your pharmacist, I need you to know this. Breastfeeding is not a guaranteed contraceptive. It reduces the risk of pregnancy significantly under the right conditions, but reduces is not the same as eliminates. Please discuss family planning with your healthcare provider, even if you are fully breastfeeding. Now, something I want to speak about very directly to you. Postpartum depression affects 1 in 5 new mothers globally. It is one of the most common complications of childbirth and one of the most undiagnosed or underdiagnosed and undertreated condition. And breastfeeding, when it is going well, can be a significant protective factor against it. Now, breastfeeding has a demonstrated reduction in the risk of postpartum depression and also anxiety. The mechanism goes back to oxytocin. Oxytocin creates feelings of warmth and attachment during nursing sessions, strengthening the mother-infant bond. Now, research indicates that oxytocin's influence on bonding enhances the mother's and child's overall emotional well-being. Now, prolactin also has a calming, almost sedating effect, creating that quiet, focused state during feeding. And the act of breastfeeding, the skin-to-skin contact, the eye contact, the physical closeness stimulates the release of additional mood-regulating chemicals. Now, breastfeeding has numerous emotional effects on mothers. The essential roles of oxytocin in maternal mental health have been well documented. And however, and I need to say this clearly, breastfeeding difficulties can also worsen anxiety and depression. Struggling to latch, pain, low supply, and pressure to breastfeed, these experiences can contribute to mental health challenges rather than protect against them. If breastfeeding is causing you significant distress, emotionally or physically, that is important information, and a mother who is mentally well and formula feeding is more present and more capable than a mother who is physically struggling and emotionally depleted and breastfeeding. Now, breastfeeding supports mental health, but your mental health must also support you. Very important. As much as it's supporting mental health also supports you. Now, I want to talk about something that I believe should be part of every conversation about breastfeeding, but almost never is. Breastfeeding reduces the risk of cancer in the mother, not slightly, not marginally, meaningfully, measurably, significantly. Now, we have what we call breast cancer. Compared to women who have never breastfed, breastfeeding mothers reduce their overall risk of breast cancer by about 10%. And the longer you breastfeed, the greater the protection. How does this happen? How does it happen? Now, the principal mechanism through which breastfeeding influences breast cancer risk is through the hormonal influence of the associated period of amenorrhea, which is the absence of menstruation. Now, this decreases lifetime exposure to menstrual cycles and therefore alters cumulative exposure to specific hormones, particularly androgens, which can influence cancer risk. In addition, the sustained exfoliation of breast tissue during lactation and the cellular changes at the end of lactation decreases breast cancer risk through the elimination of cells with DNA damage and mutation. Now, let me unpack that. During breastfeeding, you are not menstruating. No menstruation means no cyclic hormonal fluctuations, or fewer cycles means less lifetime exposure to the hormones that drive breast cancer risk. Now, fewer opportunities for abnormal cells to develop and multiply. Now, on top of that, the breast tissue itself undergoes a kind of renewal during and after breastfeeding. Old cells, damaged cells, cells with early DNA errors are shed. Now, the breast literally cleans house. We have ovarian cancer as another type of cancer. Compared to women who have never breastfed, mothers who breastfeed have a 24% lower risk of invasive ovarian cancer, according to a pooled analysis of over 13,000 cases. Now, women who fed longer and who recently were also shown to have a further decrease in risk. Now, 24% lower risk of ovarian cancer with a 5-year survival rate of only 48% of invasive ovarian cancer. That 24% reduction is not a small thing. That is lives saved. That is families kept whole. Now, Australian researchers found that women who breastfed for more than 13 months were 63% less likely to develop ovarian cancer than women who breastfed for less than 7 months. The mechanism of this, the suppression of ovulation. Few ovulation cycles means few opportunities for the repeated cell growth and repair in the ovaries that can go wrong and become cancerous. Now, this information should be on every breastfeeding poster in every clinic in the world. Now, here is one that genuinely surprises most people. Breastfeeding protects your heart. It does, not just during lactation. For the rest of your life, it protects your heart. Breastfeeding has been robustly linked to reduced maternal risk of cardiovascular disease. A systematic review that backs this up and meta-analysis involving data from over 1.1 million women found that breastfeeding was associated with significantly reduced risk of cardiovascular disease outcomes. Now, the mother's body uses its fat stores to produce milk. In doing so, it lowers her lifetime risk of cardiovascular disease, even if she came in with that risk before pregnancy. Now, mothers who breastfeed have a reduced long-term risk of cardiovascular disease, diabetes, breast, and ovarian cancer. Now, the longer the duration of breastfeeding, the greater the reduction in risk of disease. Now, think about what that means. A woman who had gestational diabetes during pregnancy, a major risk factor for future type 2 diabetes and heart disease, can meaningfully reduce that risk by breastfeeding. The mechanism is metabolic. Breastfeeding improves insulin sensitivity. It reduces triglycerides. It draws on fat stores in a way that improves the overall lipid profile. The cardiovascular system benefits from the metabolic work of lactation in ways that echo for decades. Now, this is not a short-term benefit. This is a long-term investment in a mother's future and in their health, paid for in milk. Now, here is one that confuses people because the initial part sounds alarming. Now, during breastfeeding, your body draws calcium from your bones to make milk. Yes, breastfeeding temporarily reduces bone density, if you didn't know that. For a moment, that sounds like a problem, but stay with me because the full picture is extraordinary. Breastfeeding does temporarily draw calcium from the mother's bones. However, after weaning, bone density is often restored and in some cases even strengthened. Now, this leads to a lower long-term risk of osteoporosis and fractures. What happens is this. During lactation, your body mobilizes calcium from bones to ensure your milk is calcium rich for your body's bone development. Now, bone density temporarily decreases, but after weaning, something remarkable happens. The bones rebuild, and they often rebuild stronger than before because the process of mobilization and restoration is similar to the process of building muscle through exercise. The challenge strengthens the system. This is why, somewhat counterintuitively, breastfeeding mothers have lower rates of osteoporosis and hip fractures later in life compared to those who never breastfed. Your bones temporarily sacrifice and come back more resilient. Quite interesting. Now, I want to take a moment to talk about the milk itself. Because understanding what breast milk contains helps you understand why the breastfeeding process is so transformative for both mother and the baby. Now, breast milk is constantly changing fluid. It contains antibodies, stem cells, hormones, growth factors, and enzymes, all of which have the potential to enhance development during the neonatal and infant stages. Now, stem cells in breast milk, for example, scientists have discovered human stem cells in breast milk in 2008, and researchers are still, of course, unpacking what these stem cells do, but the early evidence suggests they may assist in the development of the baby's organs and immune system in ways we are only beginning to understand. Now, breast milk is not a static formula. It changes composition based on the baby's age. Colostrum in the first days, transitional milk in the first weeks, mature milk after that. It changes composition based on the time of the day. Milk produced in the evening contains more melatonin, supporting the baby's emerging sleep cycle. It even changes composition in response to the baby's saliva. When a baby is sick, signals in the saliva during feeding prompt the mother's body to produce milk with elevated antibodies, specifically targeted at the baby's current infection. Now, the mother and the baby are in a biological conversation through the act of breastfeeding, and the baby communicates its needs through physical contact. Now, the mother's body responds in real time. No formula on earth can do that. No formula, because formula is bad. It feeds millions of babies, of course, and safely and well. But because what breast milk does is not just nutrition. It is a biological dialogue, and that dialogue has no synthetic equivalent. Now, I want to take a moment to step away from the science and speak honestly. Everything I have told you today is true. The hormones, the cancer protection, the heart benefits, the bone resilience, the extraordinary living composition of breast milk. And it is also true that breastfeeding is one of the hardest things many mothers have ever done. Latching difficulties, cracked and bleeding nipples, mastitis, painful breast infections that can make the simple act of wearing a shirt unbearable. Low supply, oversupply, a baby who will not latch, a body that has experienced trauma in childbirth and is struggling to respond. And behind all of that, the pressure, the judgment, the well-meaning advice from every direction, the comparison, the guilt when it does not go the way you hoped. I see you if you are in that place. I genuinely do. Now, the goal of this video is not to make you feel that every missed feed, every supplemental bottle, every decision to stop was a failure. It was not. The goal is to show you in the moments when it is working or when you are deciding whether to try, what your body is doing, what it is capable of, the extraordinary layered, ancient biological wisdom it is expressing every time you feed your baby. That knowledge belongs to you. Whether you breastfeed for 1 day, 1 month, 1 year, or not at all. Let me bring this together. From the very first latch, your body is flooded with prolactin and oxytocin. Your uterus begins healing. Your metabolism shifts. Your bones enter a cycle of sacrifice and renewal. Your cancer risk begins quietly, measurably, significantly to fall. Now, your heart is being protected decades into the future, and your milk, living, dynamic, constantly changing milk, is having a biological conversation with your baby, your baby that science is still only beginning to fully understand. Now, breastfeeding is not just feeding. It's just not just food for your baby. It is transformation for the mother. And the longer the duration of breastfeeding, the greater the reduction in risk of disease. But every feed, every single one, contributes something to your baby's immune system, to your cancer protection, to the bond being built in real time. And none of that is wasted, not one feed. If this video changed how you see breastfeeding, or how you see your own body, please share it with someone. Send it to a pregnant friend, share it in a mother's group, post it where new mothers can find it. Because every mother who understands what her body is doing feeds with wonder instead of pressure, and wonder is a far better companion in those 3 a.m. feeds that guilt ever was. Now, drop a comment below and tell me, did you breastfeed? What was your experience? I want to hear from you. There'll be no judgment here, and tell me what health topic you want me to cover next, even as you type your comment. Remember to subscribe if you have not already. Tap the bell. I'm Dr. Libeya Bethwel, your pharmacist, and I'll be here to bring you more content that informs, health content that informs and make you make better decisions. See you.